Hello, everybody, and welcome to the Soberful podcast. And today I am joined by Stephanie Marquesano. Did I say that correctly?
Close, yes.
Welcome, Stephanie. Now, Stephanie has a bunch of very interesting things to talk about. Stephanie is, are you the founder? You're the founder of the Harris Project.
I'm the founder and president.
Why don't you tell us what the Harris Project is about?
So let's just start by saying that in the United States, more than 21 million people have something called co-occurring disorders, which is when you have both mental health challenges and substance use issues. When my 19-year-old son Harris died by accidental overdose in 2013, we had gone through a year and a half of residential treatment programs, 4 inpatient, 2 outpatient, each saying Harris has co-occurring disorders and each saying that they treated it. So literally, the moment he was gone and everybody wanted to make donations and know what they could do to support my family, I just kept saying, they all said he had this thing. They all said that they treated it. And I am going to dedicate my life to figuring out co-occurring disorders. So the Harris Project is still the only nonprofit in the nation dedicated to co-occurring disorders, prevention, treatment, systems transformation, and really at the base, raising awareness. Can't prevent something you've never heard of. You can't demand access to better care if you don't know what's missing. So that's my sort of call to action.
I'm so sorry for your loss. Is that a picture of him behind you there?
My son Harris is on my left shoulder. My daughter Jensen, who's now 28, is on my right shoulder. My kids were best friends, 2 years, 4 months apart. Harris was older, really incredible young person, empathetic, athletic, funny as can be, really focused on like the world around him. And so, he kind of sits there keeping me, grounded and focused on the mission.
I've sadly interviewed a lot of mothers who've lost their children. Could you tell us a little bit about him? Could we start there about like the journey and so we can know Harris?
Absolutely. So Harris was a little boy who talked very early, walked very early, was very interested in the world around him. Like he was almost like the party favor, like the kids would be playing and adults would want to talk to Harris because it was so interesting how insightful he was from the time he was little. But he was also diagnosed with an anxiety disorder when he was 3 years old because he had a very hard time sort of managing his feelings. And he was viewed as a very anxious, tense kind of kid. And then it kind of progressed. And by the time he hit 8th grade, he had stopped playing sports because his anxiety disorder was so bad. He was seeing professionals from the time he was little, had a lot of friends. We live in a suburban community, intact family. Really, we were the house where everybody hung out, very involved. So, a lot of times we talk about communication. There was so much communication in our family. But 8th grade came and I was on the school board in my community and his behaviors were becoming more and more unpredictable as the year went. And he was seeing a professional. And that was when, as we were being discharged from care, my husband and I learned that Harris was smoking marijuana. So that professional thought he was just experimenting, but now I think he has a problem and he's become too much for me to manage. And so I'm done, figure something else out. We homeschooled him for the end of 8th grade. We went to a different professional. He got assessed. He picked up the ADHD diagnosis now together with the anxiety disorder. And he went on medication for the first time. He was very committed to going to our high school. We're a small community. And my husband and I were like, that's fine. Let's see what we can do. And the medication worked really, really well. Harris went back to playing soccer. He was all league and all section. And as a family collectively, we kind of felt like we're good. Harris is becoming everything that he wanted to be, and we were okay. And then, he stopped seeing that mental health professional, like the therapist. He was taking the medication, but he's like, I'm so busy, everything's good. And we're like, oh, good, we're good. And the therapist like, you're good. Never saying substances entered your life once before, and this could happen again. You need to be really careful. To me, the piece that was so missing was how this could have been prevented, how we had known a little bit more about this relationship. Had he known, I want young people to be empowered decision makers. You should know that if you have an anxiety disorder and ADHD and you're a super social kid, you're not kind of hanging back and really comfortable, being introspective and alone. You need to be careful. These things will come into your life and you need to know about it. So instead, 7th grade came. ACTs, SATs, am I playing soccer in college, just leaving a small community that you would kind of like redeemed yourself. Like his redemption arc was really good. He was like student council, like everything was okay. And he went to a party in my town. And at that point, opioids were sort of everywhere and prescription pills were available. And he took a pill. And I would say for our family, like that was when the game was over, because that was when within a year and a half before he died, that is when he entered the substance use rehabilitation side of this. Even though they said they were going to address his mental health, they never did. Anytime he came home, I mean, he went in full of hope. Being Harris, he was the kid in the group that like he'd help everybody else. He didn't really want to talk about himself. He would say like, when are they going to help me with my mental health? Like, I love you guys. I love my friends. I love everything about my life, but my brain works a million miles an hour. Like, how am I going to have the skills to not go back to what I know to do? And that's what would happen. I mean, from the very first treatment program, residential, it was the day after the St. Patrick's Day parade, his senior year of high school in New York. St. Patrick's Day is a big day for young people to go into Manhattan and to drink a lot. And he wasn't even a big drinker. I think he was just taking whatever everybody else was doing. And when he got out, it was right before graduation and prom. He celebrated his 18th birthday in a residential rehabilitation program. When he got out, I was taking him to the intensive outpatient program, the psychologist, the psychiatrist, the 12-step meeting, and the gym. Recurrence and use in under 2 weeks. And that was really the cycle for him over and over again, is that you would go, you would come back, you wouldn't have any skills that would really help you. You're seeing a variety of different professionals, all with different ideas and philosophies about what should happen, but there was no real integrated care. And so I guess, unfortunately for us, we were learning the lessons along the way that I didn't know were going to kind of guide my life moving forward, because every time I think about the shaming, the blaming, the finger pointing, kind of the destructive family dynamics that were promoted, it started to get me to think that ultimately that was designed because if you weren't using evidence-based practices and you have a loving family sitting in front of you, what are they going to say? Like, I don't blame Harris. He tried his best. I don't blame us. We tried to access care wherever we could. And so I decided to dedicate my life to kind of recalibrating around what we could do better and different. There had to be something. People thought, oh, you should go down to Florida, which is where he died. He had been in a sober home. The roommate brought in pills. They put him in a motel. They said either he's going to be fine or whatever. You don't take a 19-year-old with an anxiety disorder and ADHD and put them in a motel and say, oh, they'll either sober up or we'll put them into detox. He reached out to people he knew down there. They brought in stuff. So everything about the moments and days and months and years leading up to his death kind of prepared me for what I was going to do next. My daughter was a senior in high school when Harris died. She was a week away from her early decision application to go to college, to go away. And very selfishly, I thought, if I don't get up and do something, she's never going to go. And so in the beginning, my husband's like, you're going to need to find something to do. I was a stay-at-home mom and I'm an attorney by training. And I'm like, I'm going to figure this out. And I always say that in my tragedy, I'm really lucky. The right people enter my life at the exact right moments. And I literally rely on Harris ultimately as like the guide, because at 19, he will always be 19. When I do work with young people, I may get older, but his story is the grounding of everything that I do.
Thank you. So I want to just get this clear. Pills, what kind of pills was he?
So almost anything at the time that he could get his hands on, opioids, benzodiazepines, marijuana was big in his life. It wasn't really something that I could say this was the thing. I will say for a young person with an anxiety disorder, I think that benzodiazepines were the kind of things like Xanax and Klonopin would have been like the thing that had he had more access would have been the thing. But the other thing that I want to say is that co-occurring disorders sort of comes in almost like three flavors. The mental health challenges are existing or emerging. You're using substances for things like self-medication just to feel like everybody else. Then there's kind of the middle, the predisposition to both, which is genetics, biology, the environment. And then for young people in particular, without fully developed brains, the use brings on mental health challenges, even if they weren't on track to. So they can develop a mental health challenge and co-occurring disorders that way. Now you may be thinking, why is she stopping everything to talk about that? It's because, to me, we are playing whack-a-mole in this nation with substances. It's
Mm.
fentanyl, it's xylazine. Now fentanyl is being eradicated in Maine, so now it's methamphetamine again. Then cocaine's on an upsurge. Then there's MDMA and sort of the club drugs. And there's marijuana that's getting commercialized with nobody even talking about the risk to the developing brain, let alone alcohol, which everybody seems to forget leads to a lot of death. And so I always say that if you really understand the co-occurring disorders conversation, you will care less about the drug of the day and the root causes as to why people navigate to them to begin with. Even when you talk about suicide, there are a lot of people where, and I've heard some of your podcasts where people sort of found that the substances almost saved them from suicide. And so those are the tragic end results. I care all about what we can do about the root causes, about building the connection, about education and empowerment.
Yes. Can you say more about that, please? Because I can tell, Stephanie, it's 12 years, right?
Well, yeah, it'll be 12 in October. Yes.
Yeah, you're an expert now on this. You probably know so much compared to what you did 12 years ago. So
Yes.
can you say more about the root causes, what you've learned?
Yes. So not only am I an expert because I work with really smart people in the space, but I will say that I'm an expert because I've probably presented to more than 100,000 high school and college age students personally myself in the
Wow.
last like 6 years, 7 years since our co-occurring disorders awareness work got going. And so it's really simple. Things like anxiety disorders, depression, ADHD, emerging bipolar disorder, post-traumatic stress disorder. When you don't feel okay, you look for something to help you feel better. If you're
Bingo. That's my message. Yeah.
in social situations, some young people can use socially and there's no issue at all, right? They move through life, they're resilient, or they try something and they realize they don't really like the way it makes them feel and they just move forward. Why aren't we educating young people and their supports around them, their peers, about how at risk they are? So if 50% of our young people in the US, I think the number is like 9.5%, have a mental health challenge, right? That's our baseline as a nation. And 1 in 2 people with substance use issues, and we know it's more than this, have mental health challenges. Like on the other side, why isn't primary prevention empowering this conversation? We say mental health matters. Why does it matter? It matters because when you don't take care of it, you look for ways to feel better. And if people are already in the cycle and they're trying to get help and support, why aren't we working with the field to make sure that every psychologist, psychiatrist, social worker in this nation that's working with young people knows how to have a conversation about the risks of use straight out before, even if they say they're not using anything, they should know, their family should know. I mean, how many parents think, oh, I'm going to have my kid practice drinking? Like, no, 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 there's no such thing as practicing drinking with the developing brain, or, oh, marijuana's fine. Marijuana's maybe fine for you as an adult, but you need to understand the risks for a young person. And I know you're in recovery, and I say this with love. There's a genetic component to this at times. And
Mm-hmm.
so kids should know that if there's a family history, that they might be
100%.
at even greater risk. Like if a kid has a peanut allergy, does anybody wait for them to have the anaphylactic reaction before you give them the EpiPen? Like a 3-year-old goes to a birthday party and says, are there any nuts in this? I have an allergy. Like that is what refusal skills should be like for most of our young people in this country. Is I don't know what door this is going to open for me. You might think that taking an edible is going to help me mellow out. It might make me mellow out in the moment, or it might make me more panicky in the moment, but I may start depending on that. And I need to know that ahead of time. It's such a simple mom message. It's not like a clinical, and I think that's the beauty of the work that I do outside of the treatment side, because you and I can have a whole podcast about how we've brought integrated evidence-based treatment here, how once a week therapy is working better in my county than residential treatment or wilderness or going to all the different places. Like that's great, but how do we educate an entire country about co-occurring disorders? How do we say you can't prevent something you've never heard of? can't demand access to better care if you don't know what's missing. And that's where, for me, I guess I follow the breadcrumbs. So the work that I do here in Westchester County, New York, with our Department of Community Mental Health has literally led to an entire continuum of care from prevention through recovery. The New York Times, through Janine Interlandi, she's on the editorial board, she reached out to one of our state senators who chairs the Alcohol and Substance Use Committee at the time, and she had 5 names on a piece of paper, and I was the 3rd person she called. We were on the phone for over 2 hours. She's like, I'm sorry. She's like, I didn't realize what I was getting myself into. She embedded with me for 6 months. She went with me to present. She was part of all the Zooms on the treatment side, and she immersed herself in what we were building. It was a cover of the Sunday Review. It was a full big spread. Everybody's like, this is it. Like, your big moment has happened. And really good things happened. Like, not sitting on Good Morning America or having, like, the nation wasn't, but Partnership to End Addiction reached out, and we were working on our prevention stuff with them to this day. Center for Motivation and Change reached out, and Jeff Foote said, we are reading from the New York Times article in every workshop we do on Invitation to Change, which we now do here. And I was like, little weird that he was reading from the Times article. I'm like, okay, when you do the discussion with the clinicians, I'm hopping off because it's weird to talk about me in front of me. And then Havas New York reached out, and we did a public service campaign called You Don't Know the Half of It. Every single line in that film came from lived experience.
Wow.
Either a parent, a young person, somebody who went through the right kind of treatment in my county, people who made it out the other side almost by luck. And Daniel Wolf, who is the director, had his own lived experience with co-occurring disorders. He wasn't diagnosed until he was in his 30s. Austin Patrick, who's the lead, is in recovery. We didn't even know it when we cast her. She didn't even know what she was auditioning for. And so when it went on to win like more than 40 international and national awards, I was like, okay, this is it. Like, now everybody's going to know. But it was very provocative. It was very insightful. Anybody in recovery who watches it can see themselves firsthand in, like, in different lines of this. But it wasn't something that you could show on a Jumbotron at like a basketball game, because you would probably trigger most of the people in the crowd, or they would be really, like, most people who watch it, it's 3 minutes, you're like crying by the end. It's like you're laughing
Yeah.
in the beginning, and by the end, you're like moved. But then Havas New York said, we're fully committed to you. Like, what are we going to do next? And one of the ideas they had was pitching the editor-in-chief of Us Weekly, and it was going to be an article. And they met with Dan Wakeford, and he said, I want to do a whole special edition on co-occurring disorders. I want to reframe how we report on celebrities who are struggling, to move from being sensationalized to really look at the human experience. And we also want to do our job with you, which is to really educate and empower people around co-occurring disorders. So the stars that are living and dead who were covered, like on the cover are stars who've
Mm.
passed away. Inside, you're seeing Drew Barrymore and Kelly Osbourne and people speaking more first person. But it was so deliberate how the group was curated, because the substances were different, the ages were different, the racial economic backgrounds were different. You know, people who grew up in intact families, people who lived through the trauma of family loss. And I think that it introduces the nation to the many different ways the co-occurring disorders happen. I think that it creates more empathy and understanding about the lack of access to real care. And it kind of, like, they put in the know the signs. They spoke to the expert and have a piece with her who developed the integrated treatment protocol we use here in Westchester. They spoke to people, like they called it Around Us. And so some young people that are part of our prevention movement, and some people who I know whose children have died. One woman in Connecticut who read the article in the Times, who's doing everything that we're doing in New York now, she's trying to do in Connecticut. So it kind of gets the nation kind of to begin to change the narrative, which has been so powerful.
There's so many things I want to, I mean, number one, that's actually really powerful. I'm thinking, back in the day, Britney Spears and Lindsay Lohan, like the UK media is terrible. Just these young people, mostly women, but who are really struggling, just being like, oh, look at her, and like falling out, and look at her as having, like, when Britney did her hair, like, it's so disgusting now. It's just disgusting. It's so disgusting. What I want to ask you is, what should we be doing? Right? If someone is in your position, what do you want that to look like now? So I'm hearing you say we need a hell of a lot more prevention.
Right. Absolutely.
I've been having that conversation. I have two boys, 13 and 10, and they have known like me, like what I do in an age appropriate way from forever. And we have started having that conversation about you never take a pill. Like if your friend says, here, you have a headache or this will make you feel better, you never. We talked about fentanyl. And
Yep.
we've talked, so my husband's mother died of alcoholism when she was 38. And we've began to say this comes like just like you have my eyelashes and you have, but you also like your brain is quite likely to be different
Hmm.
and you're going to have like a different response. So we've started doing that already. But please tell us what we should be doing
Yeah.
with the equivalent of your son today.
So it's so exactly the way you framed it. I think you're going to really get this. The goal is that it's not just your children because of your genetics and biology that should be getting this message. And it doesn't just need to come from within the household because not everybody has the privilege of a mom and dad who can talk openly. Sometimes those parents are incarcerated. Sometimes these kids are in foster care. So
Yeah.
what can we do universally? Let's talk universal prevention. So CODA, co-occurring disorders awareness, started at my kitchen table. I started just having these assemblies and workshops, but it wasn't a one and done. I would leave behind like activities and how to have an awareness game and what kind of messaging you should give. And then like tools if you were setting up a table and giving out bracelets and we have our 2-star logo. And it's like, this is great. The kids are relating. The club advisors are really into CODA, co-occurring disorders awareness. Sounds wonderful. I'm one person. I'm a nonprofit of a mom. It's me. No fun, no salary. It's just like, so sustainability is a bit of a challenge. So, like I said, Partnership to End Addiction came into my world after the New York Times piece, and every county in this country has opioid settlement dollars. I'm on the New York State
Mm,
Opioid Settlement Fund Advisory Board, but the state stuff is a big lift. Local dollars, my county put out a request for proposal for prevention. I was on the Zoom with everybody. I do a lot of work. I co-chair our co-occurring system of care committee. Like I'm very involved locally. I was like, I am not going to be the lead on this grant because I want it to be a big one and I need credibility behind us. And partnership is national. So we ultimately, we got a 1-year grant for $600,000 to develop a first of its kind co-occurring disorders curriculum delivered in school settings and high school health classes, in community settings with faith groups. You can do a 2-hour lunch and learn. We have an hour in English and Spanish for parents and caregivers, an hour for school personnel, faith leaders, coaches, and it's going really well. So our pilot was amazing. They awarded us another $400,000 to expand it. We now have multiple school districts working, and on May 15th, I am training health teachers so that we don't have to do the delivery and they can actually begin to deliver this. One of our cities got their own opioid settlement dollars. We're creating 2 sessions for middle school students. And so the fun is they're going to get the base foundation with activities and hypotheticals and learning about refusal skills, which to me, refusal skills used to be, I'm on an antibiotic. I got to get up early in the morning, which only like kicks the can down like it doesn't change it. You might think this is going to help me. I'm not judging you, but I know that with how I do with these things, this might be a door that I don't want to open. Or, I play sports and I know my physical health may be impacted. No judgment, but for me, this isn't what I do. For the families, like for the adult session, the favorite 2 portions for the adults are intergenerational cycles. Like we're not judging the parents who are drinking, the moms in particular post-pandemic. There's a lot of alcohol use with women.
yeah,
So
I'm going to say I think that that's one of the big issues, to be honest with you. I remember I've done drug prevention back in the day, and parents used to say, like how can I, like what is like what do I need to like to make sure they don't take drugs? And I'm like, you're probably not going to like the answer. They're like, really? And I'm like, how do you cope with stress? Are you drinking a couple of glasses of wine every night? And they're like,
right.
they're really shocked by that. I'm like, you're probably role modeling using a
Right.
substance as a reward and for getting through the day.
Right. And so we try to kind of sidestep that a little about like, your brain is fully developed, but you do need to know that for them, this is
Mm.
very how to host a party. So, I think a lot of
Brain
communities sort of
development is so key.
yes. And they bring in the police and like there's a panel. And I always say, like, you better let the police know what I talk about if you have me on a party busting panel, because the number of times that the police actually swoop in and arrest the parents is like once every few years. These parties are going on all the time. So we want parents to begin to think about the door they're opening for their child or somebody else's child by serving or allowing things to happen earlier, to really educate about the developing brain, about kids with mental health challenges, with anxiety, who are coming to your home to have a party. And nobody, like, peer pressure isn't what we think it is. Because I've spoken to all these kids. It's not like, oh, you have to do it or we're not going to be friends with you. It's more, I don't feel okay going without doing it. Like, and so now I'm the one who's getting messy or sloppy or having a harder time. And my friends don't know what to say because they're worried about me. And everybody is in it until it becomes so concerning that people start to pull away. And then you're isolated and alone and you don't really understand how it happened, because how many times do parents and guardians and caregivers say, they thought they were doing what everybody else was doing. Like, why is it problematic for them? Like, how am I going to tell my child that they can never drink when they're 19 when everybody else is doing it? And I'm really appreciative of the sober movement. I'm really appreciative of people who are recovering out loud. I think that dry January, and I watch TikTok a lot because I think it's important to see what the trends are. And the number of influencers who had a much harder time with dry January than they thought and decided to extend it, like, that to me is such an important message. Like, I thought I was doing this socially, but I'm dependent on, like, I'm not going out. Like, I'm questioning if I'm even having fun out without drinking. Like, what am I doing? Like, that's not okay.
Yeah. What I want to ask is, what if a parent is in the situation where they know that, there's the mental health issues and the child is using alcohol and drugs? Like, what should that look like? Like, where should they go next?
So I would say that on my website, we do have like how to vet a program, the kind of questions that you should be asking, because well-meaning people will give you advice, write a
Yeah.
contract, take the door off the hinges. You should be drug testing them, like turning your house into a police
Yeah.
state, which is not really helpful. It's about finding the right support for yourself. So something like craft, community reinforcement, and family training, or invitation to change, so that you can learn sort of the motivational interviewing skills that you need to be present for your child. I mean, obviously, if there are younger children in the house, safety is a concern. So you want to create the safest environment you can. Then when you're actually looking for care, I always say it's not about more, it's about the right care. So you can have a young person who's very complicated, but with the right clinician who understands co-occurring disorders and really works through a lot of these sort of evidence-based practices. Like Encompass uses cognitive behavioral therapy, motivational enhancement therapy, contingency management. Like, that little individual package for that young person is much more effective than a lot of groups or intensive outpatients. So trusting the professionals you're working with, really asking what methodologies they're using, is more powerful than just listening to the people that are like, you need to get them out of your house. Because if they go to a residential treatment program that's about groups and not really unpacking what's going on, and you anticipate them coming home and everything being okay, that's a really scary thought, because if they go home and they begin to use the amount that they were using before and they've had time away from the substances, that's when overdose can happen quickly. That's
Mm.
when desperation to get their hands on what is now a very tainted supply happens. I mean, the schism in the parent world is really heartbreaking to me right now, about fentanyl poisoning versus accidental overdose. A fentanyl poisoning, if you go to a festival and you take one pill and you die, that is horrible. And we work to make sure that never happens. But for many young people who are navigating to a counterfeit supply, They know that there's a risk. And yet there's either this thought that it doesn't matter, which is what our public service campaign is a lot about, or they're so in over their head that they'll take anything.
Mm.
And that's what we really want to push back against, is that we need to be in this together. You know, we could focus on border control and drug trafficking forever, but there's always going to be something. I mean, for your audience, they should know, like I said, fentanyl, and now fentanyl with xylazine, and now methamphetamine is popping up again because the fentanyl thing is kind of like dissipating ever so slightly. But now I'm hearing from parents where inhalants are big again,
Oh
something called
God, yeah.
and you can get that on Amazon. You know, so again, it's like, if they're in it, they need to really understand how they're not alone, how they were possibly doing what they thought everybody else was doing, that they're
Mm.
at so much higher risk, and that they're kind of learning through a harm reduction lens, because with individual treatment and therapy that we're doing here, it's not light switch on. You send somebody away, they don't have access, right? But if you're doing community-based treatment, there's like this moment where the substance use goes down and maybe the mental health symptomology starts rising. You want to make sure that you're capturing them there. You want to make sure that if they need medication for opioid use disorder, or if they need medication for their mental health symptomology, that you're supportive of that as a family, that you're not, saying, oh, that's not a real recovery, or what. If a child had diabetes, you wouldn't say that they shouldn't get insulin. So if their brain chemistry needs medication, that's an important thing to be part of the consideration. So you want to work with even if you don't have access to the kind of therapy we're doing here, you want to work with a clinician that is working with a psychiatrist or a prescriber if they need medication, and who understands the substance use disorder component of this, because the worst thing that would happen is that they're prescribed something that they could become addicted to.
Yeah, I actually had a mother on about a year ago whose son, no issues, had a really bad football injury and got addicted to opioids and spent, I think, about 10 years in active addiction before he overdosed. And she does is education to medical providers and hospitals,
Mm-hmm.
and specifically to the patient and the patient groups about, like, because they didn't know. Prescribed by the
Right.
doctor, he had an injury, thought it was fine. Within days you're addicted. And
That's
that.
my sweet spot. So I am not athletic at all. Harris was a soccer player. My daughter was a cheerleader. She played lacrosse. She went to Syracuse, a lot of athletes. During the pandemic, I actually developed curriculum with two athletic directors locally for the National Interscholastic Athletic Administrators Association, a 4-hour curriculum on mental health and wellness and the student athlete. We covered building safety nets, particularly for student athletes who get injured, how easily they can become addicted or dependent, the depression that may come from the break in routine. Now you're taking something that's numbed you out, you're not practicing, you're not hanging out with your friends the same way, and how quickly addiction can happen. And especially now that opioids are not as available, if you get addicted, the likelihood that you're looking to a counterfeit supply is much higher, and that risk is even higher. So
Yeah.
even in our regular co-occurring curriculum now, we talk about student athletes, and we have our awareness games with our logo, because we want student athletes in this country have awareness games for like everything, very few about disorders and things that impact them that they've never heard of. So it's been
Mm.
really, really fun. You're taking like such a terrifying topic, and you're creating these conversations that are educational and really meaningful for the young people.
Yeah, I'm just sitting here like, oh, it's terrifying being a parent, and you've experienced every parent's worst nightmare. Stephanie, how are you doing? How are you doing?
I'm doing so. I'm going to be 60. I did not think that this was going to be my trajectory, life and career path. Some days, like many women, I think in the space of doing work, it's imposter syndrome. Like I always feel like there's more to do. I feel like, some days I'm like, wow, this was great. Or I hear from a parent who's trying, and it's really gratifying. But other days I'm like, it's not happening fast enough. Like, why aren't we getting the momentum that we need? And I think that it's just a balance. I look at other, a lot of times I'm asked, what would you say to another parent who lost a child?
Mm.
And I will say, if getting up and brushing your teeth is a win for you today, that is really something to celebrate. That this is not, an easy path. And for me, it was the only thing that I could do. Like, I'm not going to say it's better or worse, and I'm not even going to say it's healthy. Like, the people around me might say, like,
Yeah.
she stops. Like, she's up to email her at 3 o'clock in the morning. She's responding.
Yeah.
But I just think that it's the life that drives me and motivates me
Yeah.
and makes me feel Harris being very present. And his
Yeah.
presence is really important to me.
You can't not do it. I've met many mothers like you, and they can't not. They can't not, and dads as well. And I appreciate you letting us know about Harris. I always want to honor, what a remarkable young man, and how he's with us. He is feeling this. So I think that you should be the first. Your organization should be the first port of call for any parent who's listening to this and can identify what's going on in their family. Please tell us how they can find you and how they can benefit from your work.
Okay, so straight out, my email, which I answer every email myself, so you can send me whatever, is Stephanie@theharrisproject.org. Our website is theharrisproject.org, where you can learn more. Our Instagram is at the Harris Project COD. Same on TikTok, same on Facebook. And then on Twitter/X, we're at the Harris Pro. But I respond to everybody. And I think that if you're listening and you're thinking, what can I do just as a helper in my community? Begin to look at the funding sources, begin to look at your Department of Community Mental Health locally, begin to think about how you can bring prevention conversations into the work you do. If you're somebody who's facing the challenges with your child, like, I'm not necessarily going to have easy answers, but I will have a way to help you shape your questions as you begin to explore what the need is. And then, read the missing issue. So, I think that Us Weekly has been really generous. It's available online, obviously for free. You can access all of the articles about all of the individual celebrities, my story, knowing the signs, like all of those key pieces.
And
But they
just
also,
Us Weekly is the weekly magazine with celebrity stories, and they've partnered with you to really highlight. Yeah, they've really
yes,
highlight this issue. It's really and it's free, right? Anyone can get hold of a copy of
yes,
that.
online it's free. But if you actually want the tangible hard copy, the link is in my bio on Instagram. You can order that. So it's $8.99. It's 48 pages, and the proceeds go to benefit the Harris Project, which was very generous of them. But I think also I'm hearing from clinicians who are ordering multiple copies. They have it in the waiting room, because what better way to educate people around co-occurring disorders than through this reframe? So for some of the celebrities, the original article is on one side, sort of faded a little,
Yeah.
and then the new recalibration is on the other side. So you really get to begin to think about your own stigma and prejudice and thoughts and feelings about people who are struggling, and feel less alone, which I think is a big part of this, is that most people who are struggling feel isolated, like they're the only one. Really working to build connection is so important. I mean, look at the work that you're doing, Veronica. I mean, I think I hope you don't sell yourself short, because many people recover and it becomes part of just who they are locally or just within their family. They don't even want to talk about it. You're really creating this space where people can connect and support one another and feel less alone, which I think is really the human power of all of this work, is that it's a human message. It's not a clinical message. We could all
Yeah.
just better supports for the people around us.
Yeah. Thank you. Yeah, that's my goal is, I mean, I think it's like yours, right? We don't, it's just empathy. We don't want other people to suffer like we did or suffer as badly. If there is something we could do or say, right? That's really all it is. If there's something we could do or say to help someone else. And I feel that there's no greater purpose. So Stephanie, thank you. I really, I love what you're doing. You have my full support. Please let me know whatever we can do to help you. We'll feature all the links in our show notes and when we put it out on social media as well. I'm so sorry for your loss, and I'm so grateful for the work that you're doing. Yeah, I know so many people are going to benefit from this.
I appreciate it. Every time we get to have a conversation, I hope somebody listens and they can kind of change the trajectory of their family experience.
Yeah. Yeah. Amen to that.
Thank you.
Thanks so much for listening. Please make sure you follow Stephanie. We'll put all the links and all of that kind of stuff. And I know that she would really love if you reached out to her if you are struggling with this issue as well. Thank you so much. And we'll be back next week.
I dreamt that you were twisted through 7 suns of gold. and the gypsy was insisting that his story must be told.